This summer and fall has left me more impressed than I have ever been before, than I ever thought I could be, with the goodwill and the kindness and the generosity and the commitment and the dignity of the people who are out there to help us in healthcare, all of them. Day after day, night after night, Ann and our children and I have been thoroughly touched by acts of consideration and empathy and technical expertise that these people, and they're all over the system, nurses, doctors, technicians, housekeepers, dietitians, volunteers, aides, have brought to her bedside. Ann recalls a housekeeper who every evening would come into her room and while cleaning simply talk about her children and our children. She remembers a young infectious disease fellow who, at a time when we were very confused, very dark hour, came into Ann's room, sat down, and said what we were feeling, just labeled it. Not knowing, she said, is the worst thing of all. We were fortunate to have these caring people in our lives, and we were really fortunate to have access to care in several of the finest hospitals in our country. That makes it really hard to tell the other side of the story, because put very, very simply, the people work very well, by and large, but the system often doesn't. Every hour of our care reminded me and alerted Ann about the enormous, costly, and painful gaps between what we got in our time of need and what we needed. It has persuaded me more than I ever have felt before about how much we could improve. And I know that if what happened to Ann could happen in the best of our institutions, we need to wonder a lot about what the average must be like. We needed, first, safety, and Ann was unsafe. I've read Lucian Leape's work documenting medication errors, and I've taught about it. I've seen them now firsthand at the sharp end, sitting by Ann's bed for week after week of acute care. The errors weren't rare. The errors were the norm. The neurologist in one admission told us in the morning, he said, by no means should you get any anticholinergic agent. And a medication with profound anticholinergic side effects was given that afternoon. An attending neurologist in another admission called us by phone. He was in Amsterdam. He had decided that a crucial and potentially toxic drug should be begun immediately because of the pace of Ann's deterioration. I remember he said on the phone, time is of the essence. That was on Thursday morning at 10 a.m. Ann got her first dose 60 hours later, Saturday night at 10 p.m. Nothing I could do, nothing I did, nothing I could think of made any difference. I almost went out of my mind. Colace was discontinued by a physician's order on day one in one hospital, and it was nonetheless brought by the nurse every single evening through the following 14-day admission. Ann was supposed to receive 5 doses of a very toxic chemotherapy agent, and the nurse labeled dose number 3 as dose number 2. For half a day, no one could find a record that dose number 2 had ever been given, even though I had watched it drip in myself. I can tell you from my personal knowledge that not a day passed, not a single day without a medication error. Most weren't serious, but they all scared us.